You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Welcome to the Expert Guide to Parenthood podcast. We are your hosts, Freya and Christy, also co-founders of Parents You've Got This.
Today we're going to be talking all about hip dysplasia, which is a condition which affects some newborns, but whilst it may sound worrying, it's not. We have our paediatric orthopaedic surgeon here, Gary Nattrass, to talk all about this topic.
Now, Gary, can we start off by talking about what hip dysplasia is?
Well, hip dysplasia is a condition where the cup or the acetabulum doesn't develop properly. So basically, we've got a cup coming too far up instead of coming over. When it comes over, it protects the head. When it doesn't, then the head can move upwards and indeed even out of the joint.
Oh, how common is this in newborns?
Well, hip dysplasia itself would occur roughly 2 in 100, whereas if we're looking at actually being out of the joint, dislocated, it's probably closer to 2 in 1,000.
And so, Gary, are there any particular causes or risk factors that parents can be aware of?
Yeah, certainly there are, Freya. The risk factors we really think of would be the breech presentation, where the baby is coming out bottom first. If the baby has other associated packaging problems we talk about, and that could be in the neck where they had a tight neck muscle, the sternocleidomastoid pulling them over, or if the feet have metatarsus adductus pulling them in. If the mother has not gained enough amniotic fluid, that puts too much pressure on. Probably the main thing, though, that we ask everybody, is there a family history? We know with a family history, then there's an increased chance of the baby having hip dysplasia needs to be followed. People talk about firstborn females, but of course there are a lot of firstborn females with very well-working hips. So the reality is, regardless of these risk factors, the child needs a very good exam at birth, and then through the maternal child and health nurse, as well as any other medical practitioners.
And so how does hip dysplasia affect a child's long-term development?
Well, it's interesting in that people often, the child's not walking soon enough or doing this soon enough. Is that hip dysplasia? Well, no, it's not. The problem with hip dysplasia isn't what's happening in the short term, it's in the long term. And again, if we think of our head not getting this support, but coming up like this, that puts too much pressure on the outside of the hip and they get premature arthritis. And it's really what we're trying to do is protect that child from getting problems through adolescence and adulthood.
So it's the premature arthritis rather than pain or difficulty with mobility, or how does it work?
So if we're talking only about strict dysplasia, it may well be into adolescence or adulthood before you even knew it if it wasn't picked up. If the hip was actually out of the joint, dislocated, then it becomes more obvious once they start walking, because one leg will be shorter than the other. So they have a bit of a, or if they have both out, they can have a waddle. And so it's not waiting for those rather gross signs.
So it's trying to get it diagnosed early. And how is it diagnosed, and what's some of the typical treatment processes once it's diagnosed?
Well, the key, we feel, and baby, this little baby's already been diagnosed because he's got his brace on, but we really want that leg to be able to come apart on the clinical exam. So once again, back to our other model, if the legs come apart, that lets the cup develop because it's all cartilage. But if they're tight, they tend to come up here. So we really want who's ever doing the exam see and ensure that that leg's going out. When a hip is dislocated, you may be actually able to feel it coming in and going out. Again, as we talked about leg lengths, But the key is that we have a suspicion with every child. We talked about the risk factors. Well, in my practice right now, it's funny, it seems everybody with the known risk factors, breed, family history, they all get picked up by having an early ultrasound. It's important for parents to understand, even if there's not a risk factor, that child can still have hip dysplasia. We've had lots of third-born males have hip dysplasia. So you don't have a license against getting it just because you don't have a risk factor.
And so, Gary, if you do have a child that is diagnosed, like our baby here,
Poor little thing.
what does that mean? What do some of the treatment options look like?
Well, the good thing is, no matter what the age of the baby is or the young adult is, we do have an option for them. And early on, we tend to use a brace. And what this brace is doing, as you can see, is getting these legs apart. The brace we use has become, the bulwark of doing all work for most of the pediatric orthopedic surgeons in Victoria is called a Dennis Brown bar. And it's simple to use. Parents don't need to be scared of it. We get this on, and in general, the child comes along very, very well.
And so is it better to get diagnosed early rather than finding out later on?
Absolutely, Kirsty. It's the sooner, the better. There's no doubt, after many years of practice, I can tell you, those that we get on to early do extremely well. It's not that the others do terrible, but the older the child is, the bigger the deal.
And that must be why when you go to your maternal and child health nurse, often they're checking quite early on. I remember with my own daughter, we went and had like an ultrasound early on because they could hear like a clicking in the hips, and they were thinking, potentially she might have hip dysplasia. She didn't, but is that the sort of thing that they're looking for?
So we want that original exam done in the neonatal period, to tick the box, but then everybody needs that 6-week examination. If there's any question, we need to get an ultrasound. Ultrasounds are so easy to do, and they'll let us know where we're at with the child.
Want some extra tips to help you navigate parenthood? Join a Parents You've Got This masterclass. Visit www.parentsyouvegotthis.com.au and sign up for a masterclass today.
And so, Gary, maybe if we could just talk a little bit about the ultrasound, because I remember with my little ones being told I needed to go and do it as well. And as a parent, it was quite overwhelming thinking, oh no, what does this mean for my little one? Is the ultrasound going to hurt them? Is their leg going to be manipulated in such a way? How do I prepare for this emotionally for my sake as well as for my child? What can you sort of advise parents about that ultrasound process? Is there anything...
Not only with the ultrasound process, but the whole management of hip dysplasia. The child is fine. I never worry about the child. Yeah. The parents can go either way. Yeah. But the child will have no trouble with the ultrasound. And going back to what you said, how can the parents prepare? I think they just need to have confidence in themselves. They need to realize they're doing the right thing. Things are going to work out. There's nothing that we see that we haven't seen that we can't handle it.
Yeah, and that's what I absolutely love about your clinic. You've put together, I think, an Australian first where you have all the management that you need if your child has been diagnosed with hip dysplasia or gets diagnosed with hip dysplasia, all under the one roof. Do you want to tell everyone a little bit about that?
We're really excited with how this has worked out because while it's nice for us, it's great to hear the feedback from the parents. So we're at Cabrini in the Mother and Child Center, and we've got 4 rooms right next to each other and with a nice play area right in the middle. So in one room there's myself, and then I'm so lucky to have Prue Wiggle, who's a physiotherapist who was at the Royal Children's Hospital running their hip dysplasia clinic for many years. She sees all our new patients and gives them advice that often could even be beyond what I'm used to seeing. And then if, God forbid, they need a brace, well, next door we have the team from Ortho Kids who can get them braced up. Then if we happen to need an ultrasound on that day, because we often find ultrasounds done in the community can be very distressing to families, but when we look at them, it's obvious they weren't done quite right. It is a specialty, not just everybody can do it. So again, the team at Cabrini, the ultrasound crew has come up, and they're in one of those rooms, and we can just have the baby go right there to have their ultrasound. So with the four of us working together, we're very, very comfortable. Then when it comes time to follow up, they come in, get their ultrasound first of all, see me, and see the orthotist. And many want to check in with Prue.
Yeah. It's amazing too, Gary, having been in that space, the way that the parents actually can then lean on each other and share stories and things about, where they're at in their journey. What would be your top tips for parents who have a little one that has just got a new brace for the first time?
I'll go back to the tip I gave before. Just have confidence in themselves and their team that this is all going to be fine. The child, occasionally for the first 1 to 2 days, might be seem a little unsettled. Lots of cuddles for the first 36 hours. We can write out a prescription if you need it. But after that, the child will be fine. The parents don't need to feel they need to go out and buy the latest and greatest in clothing. It all fits and it'll all be fine. The breastfeeding is certainly some parents absolutely continue on and do well with, and they just need to find what works for them. Most of the hip dysplasia, I'll tell them the one thing I want, and that's the brace on and how long. But otherwise, you have a lot of freedom, because with the brace on, the child's not going to get in trouble. So we still can have them going over and lying prone. And
we're having tummy time, yeah.
And you're doing their tummy time, and doing our feeding, doing everything like that. As far as the what to sleep in, we like, for all babies, them not being swaddled or sleeping in anything tight. So the type of sleeping bags that come down and have lots of room down below is a positive. But once again, if they're in the brace, they're going to have to do that anyhow.
And so do you fit the brace and then they wear the brace the whole time, or is it the brace something that comes off and on? How does it work? Can you wash your baby with the brace on?
So it really depends, goes back again to what's our hip like. If our hip is in here and it's just dysplasia and it's not going to come out on us, well, yes, we'd be taking it out. A general way would be an hour a day and then gradually increasing that. So then the family can do their bathing out of the brace. On the other hand, if the hip is out of the cup to start with, and then we get those legs apart, get the head in there, we don't want them taking it out for bracing, because boink, out it comes, okay? And so there might be a 3 or 4 week period where they need to sponge bathe the baby. But that'll end in 3 or 4 weeks, and then they'll continue on their journey. I must say, after all these years of seeing this journey, it's great to go along with the families, because everyone comes in scared, and by the end they are experts. And I do love what you pointed out to that center area where you can see the veterans giving the rookies tips on it all. And you can see these little ones now that are 3 or 4 years old, they're running all over the place, and parents get the idea, this is going to work out okay.
Yeah, that's the biggest thing about parenthood, isn't it? It's just that worry. The worry of what does this mean if it's not normal. But obviously, through all of your expert care, you can reassure everybody that everything's going to be okay. How long are they in one of the braces if you are diagnosed with hip dysplasia?
Well, again, we do try and individualize the treatment there, Chrissy, so we don't quite have a recipe book what to do. But in general, if a child came in with strictly dysplasia, they probably look at 3 months. Even if they're young enough and dislocated, it would probably still be just 3 months. We, again, are gradually decreasing how much they wear it. But then the key thing is that we follow them for many years, really. Not every 3 weeks, but eventually at 3 and 4 year intervals. If a child presents later, say the 6 month to 9 month, perhaps that child would be treated longer. or indeed if the hip is actually dislocated and they're over 6 months, often those children actually need to go to theater and have the hip gently put back into place in the operating theater and then go into plaster. Their bracing would more go to probably 4 or 5 months.
Wanted to ask you about that, Gary, about the instances in which surgery is recommended. Is it purely age-based, or would a newborn, particularly if a newborn had a particularly severe case, require surgery too?
So if a newborn came in, say somebody 4 months and under came in with a dislocated hip, in general you would always give a trial of bracing. And statistically, they have up to a 93% chance of success strictly with bracing. There are some kids that are really tight, bracing just doesn't work, or there could be something blocking getting in.
Yeah.
So those, that group, we would, that we can't get in place, or if they're over 6 months, we'd probably take them directly to theater and see if just being asleep we might be able to put it in, or sometimes we may make a small incision in the groin and get them in. So that's the type of surgery to get the hip back into the joint. Then there's that next group, once we start getting over 18 months, that we might need to do something for the bone itself. Sometimes we need to cut the pelvic bone and bring it over. Sometimes we tip the femur bone in more. But in general, the kids that we're seeing from an early stage, it's many years before, well, hopefully never need any surgery, but those that do need surgery, it would be more up to 3, 4, or 5-year-old.
And what's the role of a physio? You mentioned that they have a physio that works with you. What does a physio do for hip dysplasia?
Well, again, I'm pretty biased about the role of physio. For me, she's a great help and certainly alleviating the parents' concern and gives excellent examination to the whole child and can have good, helpful tips. I think in general, though, parents shouldn't feel that physio ongoing is something that's necessary. Where it would be helpful if they had those associated conditions, like we talked about the torticollis with the neck, or the feet that are metatarsus adductus. But it's not a routine, I don't feel needs to be a routine part of the care of the child going forward.
Thank you so much, Gary, for alleviating so many people's concerns. I think hip dysplasia looms as this huge thing, and even if your child is diagnosed with it, you've really explained today that, you know, just have confidence in the healthcare system. Experts such as yourself are there on hand, and with your amazing team, it will all be okay. So thank you very much for your time today and for sharing your expertise.
Thank you.
A huge thanks to Mistela for sponsoring this episode. As much as we want to, we cannot wrap our kids in cotton wool or bubble wrap. With Mistela's Ciccastella SOS Recovery Cream, you can let your kids explore the world. Ciccastella is a multi-purpose cream for little skin boo-boos like scrapes and scratches, insect bites, dribble rash, minor burns, or broken skin due to eczema, and it doesn't sting. All of the Mistela products are dermatologist and paediatrician tested. Mistela is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast, and never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.